Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. On today's show, we will learn more about the long-term impacts of COVID-19 and how RWJBarnabas Health can help. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. Recovery from COVID-19 can be a long journey. Patients may experience ongoing health and behavioral issues for months after contracting this novel and extremely complex virus. St. Barnabas Medical Center and the RWJBarnabas Health Medical Group have launched the Post-COVID Care Program, which stands for Comprehensive Assessment, Recovery, and Evaluation Program. We are joined today by a special guest, Dr. Vanessa Trespalacios, an RWJBarnabas Health Medical Group provider who is the Post-COVID Care Medical Director. In accordance with social distancing due to COVID-19 pandemic, Dr. Trespalacios is joining us remotely via video conferencing. Thank you, Dr. Trespalacios, for being here. Now, since this is such a new topic, the audience would love to know a little bit about your background, who you are, education, and what made you do what you're doing right now.
Sure. Thank you for having me, Dr. Ashinsky. My background is in primary care. I am an internist. I trained here in New Jersey and have been with RWJBarnabas for the last 8 years. Prior to that, I was at Atlantic Health for close to 10 years. And my interest in this particular topic was because we were starting to see a lot of patients that, despite having recovered from their acute illness with COVID, continued to have some symptoms that were disrupting their quality of life. And so we identified this need and started to do some investigation and some studying on what this could be caused by. There are not a lot of answers. And so we thought we should try to help these patients because a lot of them, as well as their primary care doctors, were becoming quite frustrated at the lack of resources for them, with little understanding about this disease process and specifically about the post-COVID syndrome.
So let's begin. At the beginning, COVID-19, the novel virus, basically has been with us now for approximately a year. Tell us what your thoughts are on how it affects the body.
So the first thing for everyone to understand is that coronavirus itself is not new. Coronavirus was identified in the 1960s, actually, and it's responsible for the common cold. There's about 1/3 of community-acquired upper respiratory tract infections in adults, and it probably also plays a role in severe respiratory infections, both in adults and children. Coronavirus was also the virus family responsible for the Middle Eastern Respiratory Syndrome, or MERS as we know it, as well as the original SARS-CoV, Severe Acute Respiratory Syndrome. Coronaviruses are widespread with bats, among both birds and mammals, and with bats being the host to the largest variety of the coronaviruses. Thus far, we've identified 6 coronavirus serotypes that have been associated with disease in humans, and SARS-CoV-2 is the newest of them, or the novel or new coronavirus. The way that it acts upon the human body, it causes this massive inflammatory reaction, massive release of cytokines, which are inflammatory proteins that cause disease in all of the organ symptoms. Specifically, the most common organ system that we see being affected are the lungs, the respiratory system. But actually, coronavirus or COVID can affect pretty much any organ system in the body.
So again, what the audience needs to understand is, one, coronaviruses have been around for a very, very long period of time. The reason why we call this COVID-19 is that this variant of the virus was discovered in the year 2019.
Correct.
And that the problem that this virus causes is the influx of cytokines, which are the highly inflammatory product that our body makes in order to help destroy viruses. But what happens is that the body overproduces this in both the lungs, the heart, the brain, the kidneys, and that the seriousness of this virus is that there's so much inflammatory product going on that the body has no idea what to do with it, and that's why we end up with respiratory distress. That's why some people end up with myocarditis, and that's why some people end up with what they call corona brain, where they seem to be slower to respond and not be what they had been.
There's even more than that. I mean, I have seen patients that have ended up with olfactory hallucinations, patients that continue to have anosmia or loss of smell. There's patients that have had seizures due to post-COVID syndrome, memory loss, real cognitive decline, patients who are high functioning, highly educated, and have been unable to return to work due to the brain fog or the memory loss, the lack of quickness to respond, word finding difficulty, a lot of these neurologic symptoms. And those have persisted and have been a big part of the post-COVID syndrome. But as you said, yes, the most common one is the pulmonary complaints or pulmonary disease post-COVID or pulmonary dysfunction.
And the problem the big problem is we have no idea who's going to be that and who's not going to be that.
Precisely. It's estimated that approximately 30% of patients that have been infected, just regardless of whether they had mild or severe or critical disease, regardless of having been hospitalized or on respiratory support, 30% of all patients affected by this will have lingering symptoms or post-COVID syndrome.
Which again is very different than the normal variant flu that we get each year, where most people don't end up with any long-term side effects, while this COVID-19 novel virus does have the long-term side effects.
Correct.
And the important thing is that people such as you, through the leadership of RWJBarnabas Health, have figured out that something needs to be done to help these people, because a large percentage of people who are infected with the COVID-19 virus do end up with these long-term side effects, and we have no idea how to help them recover.
Correct. When you think about it, 30%. It's estimated so far that we have had 96.2 million confirmed cases worldwide. And that's just confirmed cases, not cases that we weren't able to confirm. Remember, initially, early on, we didn't have enough testing. Initially, we didn't have any testing. And so there's a lot of cases that occurred initially that have not been confirmed. So it's estimated that it's actually tenfold that amount or that number of patients worldwide that have been affected. So if you take 30% even just of the 96 million, that's a large population of patients that are requiring continued support and continued healthcare that they did not require previous to this disease.
So what we've learned is that the RWJBarnabas Health Medical System and all of the physicians associated with it, we have been trying to acutely treat the initial person in the emergency room with the monoclonal antibodies. And if that doesn't work, we admit them to the hospital and we give them the high-dose IV dexamethasone or remdesivir, and hopefully they respond to that and get over their acute phase of it. But the problem is the long-term effects of it down the road. Even though they've recovered from it, it's the brain fog, it's the myocarditis, it's the pulmonary inflammation. And what RWJBarnabas Health and you realized is we needed some type of multidisciplinary type of program to put together to help these people. So do you want to describe that program itself?
Absolutely. So the program, as you said, is a multidisciplinary program. It involves all types of subspecialties. You mentioned pulmonary and cardiac. We also have seen some GI effects, dermatologic effects, as we discussed some neurologic effects, not just brain fog, but others, some renal dysfunction, so many different areas that have been affected. So we realized very early on that this had to be a multidisciplinary program. We can't just focus on one aspect of it because not everyone has the same lingering symptoms.
And the big thing is, as a primary care physician, and when I'm seeing these people in the office, I don't have the tools necessary to take care of it, while you have been smart enough to put together this team, and you call it actually the Post-COVID Care Program, where I can actually refer them to you being the one to manage the multidisciplinary committee and the physicians, providers, et cetera, in order to help this patient.
Correct. So patients are referred by primary care physicians as yourself or like myself. And when they come here, we're not taking over any of their primary care. In fact, anything that has to do with their primary care or any complaints outside of post-COVID syndrome was referred directly back to their primary care doctor. We have a multidisciplinary team, like I said, all of those subspecialists. And the program really, the center of the program, or the hub of the program, is actually a nurse navigator, which was my one specific ask when we were developing this program. As you know, oftentimes if somebody needs a neurology consultation, just as an example, the next available appointment might not be for another 6, 7, or 8 weeks. And in these patients, part of the issue is exactly that they can't get any help in a timely manner. And so the nurse navigator helps them navigate that. We have this team of subspecialists that are available to us within 5 to 7 business days. So we're able to get patients in a very timely manner. Same goes for any testing that we need. For example, if we need to get pulmonary function testing or an echocardiogram, we are able to do that in a timely manner due to the nurse navigator and the commitment from the team members that we have, all of these subspecialists, different departments, physical therapy department, cognitive therapy, the radiology department. So that is the center, the hub, as I said, of the program is really this navigator, which helps the patients from the beginning, from that first contact, all the way through their entire journey throughout the program.
So if a patient suspects that they are someone who would be a candidate for this, what as a primary care physician should I do, or what should the patient themselves do in order to get themselves into such a program?
All you need to do is contact us either via email, via phone. You can call us. Some of the primary care doctors that I know personally have contacted me directly, but the patient doesn't need to be referred by their primary care. Patients have found out about us throughout media and marketing and have been able to contact us directly. Some patients don't have a primary care doctor. So there isn't any specific need in order to contact the program. We do have inclusion criteria, which are first that you have a positive PCR testing, that's either saliva or nasal swab. And of course, that you have ongoing symptoms that have persisted more than 4 weeks after your acute illness has resolved. You know, as we see often with even flu virus, it can take more than a couple of weeks to fully recover. And so we need to give it some time, and some patients take a little bit of more than 2 weeks to recover. So we want to see those patients that truly have lingering symptoms. So our requirements are, our main requirements are those two. Anybody that has any of those, that fits those criteria, can be a candidate for this program.
Okay, so the person contacts you, or they actually contact the nurse navigator, and what should they expect on their initial visit?
So before they even step foot into the office for their initial visit with the internist, that's myself or other providers that are participating in the program as well, they will receive a call back from the nurse navigator, who will go through their entire story. When were you first affected by this? When did you discover that you were sick? What was your disease course? She gathers all of that information so that we know what we're dealing with. What are your lingering symptoms? What kind of medications have you tried? What has worked? What has helped? What has not? What testing have you had? What their prior history is. And we also have a clinical pharmacist who goes through all of their medications with them prior to their coming in for their visit, again, with the intention of discovering what kind of medications or treatments they've tried so far that have not worked, so that we don't go back and repeat all of that. And then they come in for their physical visit with us. We do a comprehensive exam. We do a cognitive exam if they're complaining of any cognitive complaints. So the exam is really tailored to what their main complaints are. And it doesn't have to be just one main complaint. Whatever complaint they have, that is their lingering symptoms. Some patients have a number of lingering symptoms. Some patients have pulmonary symptoms such as shortness of breath and cough, plus fatigue, plus brain fog, plus chest discomfort or chest pain. And so we address all of those that are considered their lingering symptoms. So a full exam, and then we develop a plan specifically tailored to that patient. So each plan is individualized.
And again, since this is only an initial startup, and we really don't have long-term, we really don't know long-term, what should the patient expect?
In the program, what they can expect is that we will, again, tailor the plan to their specific needs. The nurse navigator will meet with them personally, and at that point begin the process of either, if it's a referral to the pulmonologist, help them to get that appointment with the pulmonologist that's part of the team, help them get their pulmonary function test done and coordinate all of that with them. If we have some difficulties with getting medications approved, if we want to try a new, for example, we had a patient that we were, based on their results, I wanted to put them on a specific inhaler, and their insurance was not approving them, but we have a lot of the data, the research that supports the reason why we want to do this. And so we were able to fight it and successfully get that medication approved for them. Now, I can't guarantee this in all of the situations, but we are, as I said, focusing specifically on each patient's particular needs. And so our plan is tailored to that patient specifically. And so we will do our best. And we have a lot of information to support the things that we're doing. And so it's more likely that we'll be able to get it done.
Again, this is something that is very fluid.
It is.
We're learning something new every day. And when you go to sleep at night thinking one thing, you wake up in the morning and suddenly things are different. And so patients who are in this program have to understand at the same time that we're learning along with them. And that, again, the important thing is that you being so important to running this program, someone who's very learned, someone who has a lot of knowledge, and someone who has dedication to this, that's so important to this program.
Yes, that is what's different about this program, as opposed to seeing a specialist who's not involved in the program, that we are all dedicated to this one goal, which is to help all of these patients return to their previous state of health. As you said, it's very fluid. We are learning every day. We're finding new information every day. And a lot of it is empiric, meaning that as we try something and we see that this is working better, then now I'm able to use that in the next patient to help them more quickly. To that end, we are also conducting a lot of research through the program to help discover exactly that. What are the modalities? What are the medications? What are the treatments? What are the programs that have helped these patients the most, so that we can apply that to the next patient? So each patient that comes in is vital to the program's success. Each patient teaches us something else. So the patients have been wonderful, and they're actually, even if we don't have all of the answers, they understand that. All the patients have been very understanding of that, and they are happy to have someone that believes them, Some of them have been turned away by other doctors, telling them, "Oh, just get some more rest. You'll get better very soon." They're so appreciative of what we're doing, and so even if we don't have all the answers right away, they have been very patient with us.
Well, the reason that they're so appreciative is that you're the center of this. And as a primary care physician, you're looking at the whole patient and not just one simple system. The problem with some of these other programs which have come out similar to this is that a primary care physician is not the center of it. A specialist is, and the specialist is only looking at that one system. You're looking at the whole general health of the person. And since, again, you are an internal medicine primary care physician, you're looking at that whole patient, not just the system.
Yes, that is absolutely true. And as you said, there are a lot of programs that have come up, but they are all, or not all of them, but a lot of them are run by subspecialists, mainly by pulmonologists, which is great. And I'm sure that they're doing a great job in their area. But these patients need much more than one system being addressed.
Especially because many of them are being told of depression, of anxiety, of all of these other things, and the pulmonary person doesn't deal with that, and you do.
Absolutely. That was another area that I specifically asked that we have a big commitment from. As you know, as a primary care doctor, behavioral health has always been a very difficult area, not only to have patients agree to seeing a behavioral health specialist, but even to have available behavioral health specialists to care for these patients. And so imagine with what's been going on, this pandemic, and so many people dying from this virus, if you were told that you were testing positive, a lot of these patients, even just testing positive, even if they had only mild disease, have been left with some level of post-traumatic stress disorder from the scare, being so worried that they're going to end up dying. And then think about the patients with the critical diseases, with respiratory failure, that have ended up in the hospital on life support, on a ventilator for months, and then recovered. Those patients have severe post-traumatic stress disorder. I mean, they weren't even able to see their family members to get some kind of emotional support due to the pandemic. And it's through no fault of anyone's. It's just the nature of what's happening at this point in time in the world.
Well, again, the important thing is I've got a very learned primary care person at the center of this all, who's learning at the same time that the patients do, putting that knowledge to use. At the same time, has at her fingertips a nurse navigator who's able to get the person into a pulmonary specialist, a cardiologist specialist, a neurologist specialist quickly, also to get the tests available that are necessary. Because I know as a primary care physician, if I try to get a pulmonary function test done on a patient, it's virtually impossible right now with COVID because of all the protocols one has to jump through in order to get it. And the fact is that you've worked with these specialists, with the ancillary providers, et cetera, so that if you actually deem it appropriate to do, you can get that done.
Absolutely, and in a very timely manner. We have a lot of ancillary support at our fingertips, and pretty much anything that we need, that we deem necessary for that patient, we're able to get in a timely manner.
Which again shows how important RWJBarnabas Health leadership is, the fact that they're giving you the ability to take care of these patients to the best that we can, to be fluid with the decisions so that we can make these long-term COVID recovering patients improve in their medical status. Absolutely.
And that's the beauty of having the support of a system like RWJBarnabas. The leadership was on board from the get-go. We have all of the different areas that need to be covered available to us. And the leadership has been very, very supportive of this program and very excited about it. So that's been instrumental. I can't imagine being able to do anything similar to this without the support of a system such as RWJBarnabas.
Well, I don't see anything like this out on the horizon in New York City, in New Jersey, in the tri-state county area. I see you as being a leader in putting this, in promoting this, in doing this, and putting this together in such a short amount of time, and doing it so well in the multidisciplinary character, the multidisciplinary providers, ancillary services that you've been able to do. And I have to actually congratulate you for doing such a job.
Thank you. I really appreciate that. You know, time is of the essence. Much like with the vaccine, it's been so important to do this now. Now is when the need is here, and we can't wait on things like this. This is affecting the entire world in a very robust manner, for lack of a better word. And the need was here. The need is now. And so there was no time to waste. And again, that's where leadership also helped us in getting this done so quickly. From idea to launch was just about a month and a half. We really were able to do this in a very short period of time because we had the support.
Which is great. Again, shows us how important RWJBarnabas Health leadership is, also how important you are in doing this, and the fact that you didn't just sit on your hands and say, wow, I can't do this. You actually got up, pulled yourself up by your bootstraps, and put this whole program together in a short period of time to really improve the livelihoods of these people.
I won't lie, it's been a lot of work, and I've put a lot of hours into it, but it's been very rewarding to be able to see these patients, and like I said, how appreciative they are. And luckily we've been lucky enough to see our first follow-up patients recently, and specifically I saw one patient yesterday, my very first follow-up actually, after 3 months, and she reported significant improvement in her symptoms due to the modality that we implemented based on our experience here and with patients that we've been treating for COVID, myself and the other providers involved, the subspecialists involved since inception. So that was very rewarding. So the work and the hours have paid off, even with just that one patient so far having had such significant improvement in her symptoms. I'm very happy about that.
Well, thank you, Dr. Trespalacios, for being here. Thank you for for everything you've done for RWJBarnabas Health. Thank you for helping to put this program together. Thank you for putting this multidisciplinary program together. You really are making advances in medical science. You're really helping improving patients.
Thank you so much. Please, any patient that feels that they need some help, reach out to us. Primary care doctors, you can refer any of your patients. If they're not someone that meets the criteria for inclusion in this program, we're still trying to help as many people as we can. So please just refer them, and we'll do whatever is in our power to help them.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral line at 888-724-7123. For more information about the Post-COVID Care Program, please call 888-COVID-94. That's COVID 94, or email postcovidcare, postcovidcare @ rwjbh.org.